It's definitely a scary diagnosis. No one ever is prepared or ready to find out that they have cancer.
Breast cancer really changes your whole life, changes the way you interact with your family, with your work. It's a hard journey.
The staff and doctors here at Sanford do an incredible job of making sure that the patient comes first.
Being able to come to one place that is close to home just makes the journey so much better and easier.
The care that we try to provide is, of course, for our cancer patient, they are our sole purpose. However, we know that the cancer journey is not just the patient. We know that it's their children, their spouse.
I had seen a lot of, cancer patients. I had seen terminal cancer patients. I never expected that, it would be my mom who was a patient with breast cancer.
I consider myself fairly strong, and I know I have a good support system. So I was hoping, to get through everything, but yet there's always that fear that maybe you're not going to get through it, and what that impact will have on the family. Not knowing what's coming for sure is pretty scary.
Chance for extra credit.
She is the ideal mother. Melissa is an amazing woman, and people talk about wanting to make the world a better place, but she actually does.
I had seen Dr. Anderson here at the clinic in Canastota, and she was a little concerned about some issues that I was having.
She was understandably concerned, as was I, and so we tried to facilitate getting this looked at and resolved as quickly as we could. I also reassured her that there's treatment nearby.
So she sent me to the Edith Sanford clinic. It was a little scary, but the nurses and the people that we dealt with were just amazing and just walking us through everything. They had decided that there was definitely something there and they would like to do a biopsy. And then the next day they called back. I kind of knew the minute I saw that call coming in that it was cancer.
I kind of feel like everyone sees their parents as these, invincible people who are never going to get sick and they're always going to be okay.
I was super worried about her. I didn't know enough about cancer to understand what the next few months were going to look like.
We have been patients at Sanford for as long as I can remember. We talked about it a lot and just felt that the Edith Sanford was definitely the best way to go.
So she did chemo, then radiation, then surgery, then more chemo. It's a long road. It's a long road. You don't understand the impact of all that until you go through it.
It was hard to watch her have to be that strong.
She was sick all the time, and it was just it was a different way of seeing her. I just wasn't used to it. It was a real struggle.
I was tired all the time. There's always something going on with our family, somebody's birthday party or something going on. And that was hard for me not to be able to go to that stuff. That was a struggle.
Just to watch my wife suffer, that's where you can't do anything about it. That's tough.
Probably the hardest part of everything, going through the treatment, I still think has to do with just the effect that it has on the kids. So I think that's probably been the hardest for me, is just seeing the impact that it has on everybody else. So sometimes you just gotta cry it out. Sometimes that's all it takes is a good cry, and then you're good to go.
I remember coming and seeing Melissa for her first chemotherapy appointment. And she was just sitting there and she gave me the biggest smile. And I was like, she's gonna be okay. She is definitely gonna make it through, without a doubt. She has a lot of inner strength.
What am I, getting close to a year remission now? This far out, it's still a struggle. There's just so much relief, and also just knowing that you made it.
We look forward to continuing strong research. We aim to get to a cure for breast cancer. With philanthropy, we can get there a lot faster, hopefully.
Know that it's gonna go to good causes. It's gonna go to future equipment for our cancer patients to make sure that we catch cancer as early as possible so we can treat it easier.
This is the best way to locally support your community is by donating to the Edith Sanford Center. 100% of every dollar that gets donated stays here. It fuels life-changing moments throughout the cancer journey. Our whole nurse navigation program is funded by philanthropy.
When I think of like the nurse navigator and Cammie, everything that she did for us through that process, and knowing that that wasn't possible without the fundraising efforts, that speaks volumes.
I lost my mom to breast cancer about 5 years ago. Being a daughter sitting in that chair and, my mother experiencing everything that she experienced, I think made me more equipped to be in this job because I have been on both sides of the chair before.
Most thankful that she's okay and that we have a good outlook after this. I'm incredibly proud of my mom.
I am so thankful for my health right now. Thankful for, the team of doctors and nurses and everybody at Edith Sanford that helped me get where I am. I'm thankful for my family for helping me get here. There's just so many people that helped me get where I am, so I'm so thankful for everybody. Yeah, there's times along the journey when you're not sure if you're gonna be able to go through it, but I just couldn't have asked for a better team.